Family planning is voluntary. No one should feel coerced to take up a method. If these methods are explained to you and you feel you are not ready for it, it's advisable to go home, reflect on it, discuss it with your partner, and then come back at another time to take up a method. In as much as one needs family planning or contraceptive methods to be able to plan their family, it's not the best to feel forced to take it. So whenever you have this discussion with your healthcare provider, if you feel you are not ready for it, or you think that this method is not convenient for you, it's not compulsory. Just tell your health worker to pause, you go home, reflect over it, discuss it with your partner, see the do's and the don'ts, the benefits and the risk of it. And then later, at a later date, you can come back and rediscuss it with your healthcare provider, and then you make a choice. There are several methods available. So if A is not good for you, we can try B. For you know, B will be perfect for you. You do not have to make a choice as at the time you are being counseled. There's something called medical eligibility criteria. What does this entail? It's before a family planning method is taken up by a couple, you need to make sure their medical issues, or if they have any medical issues, it's compatible with the family planning method she may decide to take. Some people have hypertension, some people have diabetes, some people are obese, some people have liver problems or kidney problems or any other medical condition in which taking up a certain kind of contraceptive method or family planning method is not advisable. So the medical eligibility criteria is there so that health workers that are counseling these women would have it in mind, will keep it in mind before letting a woman or allowing a woman to take up this method. It's just a wheel in which we input your medical condition and then directs the wheel to give us the best method available for you. Before you take up a family planning method, we need to make sure you're not pregnant. I mean, that's the whole point of contraception and family planning, right? We need to ensure that at a time you want to get pregnant, that is when you get pregnant. So before you take up a method, it's advisable for us to find out whether you are pregnant or not. And there are some 6 questions that you'll be asked when you go to a healthcare provider for him or her to give you a family planning method. The first one: how long ago was your last monthly bleeding? Was it 7 days ago or more? Have you abstained from sexual intercourse since your last menses? Or have you had any abortion or miscarriage since your last menses? Have you been using any reliable contraceptive consistently and correctly since your last menstrual period, delivery, abortion, or miscarriage? Have you had a baby in the last 4 weeks? Did you have a baby less than 6 months ago? Are you fully breastfeeding or nearly fully breastfeeding? Has your menses not started after you delivered? Have you had a miscarriage in the past 7 days? These are 6 questions that will be asked. If you answer no to all of them, most likely you are not pregnant. But if you answer yes to any of them, then the healthcare provider goes on to do a pregnancy test to ensure that you're not pregnant before you take up this family planning method. In the next part of the show, we are going to talk about the various types of family planning methods, how to perform them, the do's, the don'ts, the benefits and the risk of these methods.